Thank you very much, Atul. And you have not 20 minutes, but perhaps less, about management of cardiometabolic disorder in different parts of the world. What can we learn for the management of patients from the Indian Ocean? Thank you, Atul.
So basically, je sais pas, je fais en français ou en anglais? Bon,
en toulousain.
En toulousain. Donc en fait, l'idée de cette session, c'était de partir d'un constat très simple, c'est qu'en fait, malheureusement, la France ne dispose pas de données ethniques. On n'a pas de données en France. La loi actuellement ne nous permet pas de recueillir l'origine des patients et donc on ne peut pas faire de statistiques ou d'études dans lesquelles... Bon, je peux plutôt en aller? Okay. So in fact, we are having je peux faire en allemand aussi. We have a lot of problems in France regarding the data. In fact, it's not allowed because of the law to get and to gather some ethnic data. So we are suffering from a lack of information regarding the management of patients, where sometimes the ethnic origin could be of help to change the way we are treating these patients, but also to allow us to be more active in terms of preventing events. And Ruben is right, we set up this session because it's been now 10 years. We are working together, and whenever you give a talk in Réunion, you always have this question about, yes, but I have a patient who is from this origin, and you think I should change the way I'm managing him? Should I offer him a new type of treatment? And we have been really challenged with very practical clinical questions, going from side effect with statins to how to treat hypertensive patient in a black patient, how to manage chronic kidney disease, how do you explain the fact that there are so many diabetic patients on the island? Is there a kind of specific salt sensitivity in these patients who are initially coming from China, who are exposed to increased blood pressure, and even some very practical questions about the effect of heat, or how to manage to use diuretic in a part of the world where sometimes you are challenged by temperature. So very practical, very clinical questions, and always being challenged by the fact that we do not have these ethnic data. And so basically we try to thought, okay, how can we provide an answer to our colleagues and friends, probably by learning from experts in this big region, where sometimes ethnicity is not a problem, you have access to this type of data, or basically they are able to manage patients we are familiar with. And so basically when we started to set up the session, we had a very specific focus on diabetes. You know, it's a very prevalent disease in this part of the world, and the leader or the world champion for diabetes is India, so we will have a talk about the management and the way you have to adapt the management of diabetes or not. Maybe the answer will be that there are no differences between some part of the world and this part, the specific part. How to manage hypertension, and especially hypertension in black. And so we asked Brian Reiner to come and share with us his experience about this particular problem, or have a glimpse into the management of heart failure, and Caroline Lamb will talk about this later. I just extracted this short newspaper extract from the internet, showing that more specifically here, because it's a joint session between Reunion Island and Mauritius, that cardiovascular disease remain here the major cause of mortality, still true for the last 20 years. First cause of hospitalization, first cause of death, the second being diabetes. So we are really at the core of our session here, the third being cancer in Mauritius. And going back to some very specific data, if you focus, for example, on this world map showing the global contribution of ischemic heart disease, but also of cardiovascular disease mortality in males. And if you focus on this belt, I've called it the risk belt, well, you see that, well, we are not all red, we are not having all the maximum risk of cardiovascular mortality, but you see that it's between orange and red. So this part of the world is really concerned by cardiovascular disease mortality. And if you specifically focus on mortality due to ischemic heart disease, then you really see that probably because of the burden of diabetes in India, of other cardiovascular risk factors here and there, you start to see that these countries are becoming red. So really, I think that in the Indian Ocean, we are the world. Basically, we do have the patients who are coming from all the other parts of the world, and I hope that during this session we'll have some nice discussion and some nice explanation about how to manage ethnicity in this part of the world. So without further delay, Jean-Philippe, if you allow me, we'll maybe jump to the next session, and we'll try to keep the time tight, but also give a lot of time to the exchange and interaction. So maybe you can introduce the next speaker. Thank you for your attention.